Well, good morning, everyone. I'm sure you had a wonderful plenary session, and you are all set for this particular session today, which is entitled Joining Hands for Innovation. And my name is Dr. Sanjeev Kumar. I'm going to be a moderator for this particular session. I'm very excited to meet you all, listen to the wonderful three presentations we are going to have in this session. Just as a ground rules, as Steve would have said, we would have the sessions presented first. The question and answer for all the three will be taken up once the three presentations have been finished. Each presenter has about 10 minutes to make a presentation, and question answers can follow from that. So look forward to an exciting session. And if you have any questions, please feel free to put it in the chat box. We would be taking it up. The number has a number of questions that has been put together. Maybe club some questions together and see if we get wonderful, deeper insight and probably cross-sectional insight from the papers as well as from the different countries and representations we have today. So here we are, all set. Today's session is going to be three sessions. We'll start with number one session, which is entitled Faith Leaders as Change Agents to Reduce Early Marriage Incidents in Afghanistan. And the authors are Natia Ubilava and Kate Kobaidze. Pardon me if my pronunciation of the names is wrong. I'll try to make up for that once I learned it from you. Second paper would be followed by the first paper, Sustaining Behavior Change with Local Government Engagements, Suhara #2 project, a success story for Nepal. The authors there are Indra Doj Shetri, Bishowraman Neupane, and Pooja Pandey. The third paper, very interestingly titled, is Fail Early, Fail Fast, Fail Often, but Don't Fail Big. Managing Behavioral Science-Backed Innovative Products and Services in 3 Low-Income Countries. And the authors there are Reshma, Trasi, Cecilia Angelon, Shoaib Hussain, Zakari Congo, Keste Beharan, and Mohammed Brooks. So without much ado, I'm so eager to listen to the three presentations, and we will start with Faith Leaders. Who is presenting? Natia or Kate? Who is presenting? Kate, are you presenting?
Hello, good morning. Yes, we have a recording of the presentation. I believe it's ready.
All right, sounds good. So we'll play the recording and then we will take it forward to the Q&A session after the three presentations are over. Thank you very much, Kate. Look forward to hearing from you and Natia after the sessions. Asim, can we play the presentation number one?
Yes, going ahead with it.
We have a wonderful audience and look forward to hearing about their opinions, their questions, and perspectives on the presentations which we have lined up today for you.
Greetings, everyone. This is Kate. We are grateful for this chance to present learnings from a project measurement that was implemented by World Vision Afghanistan from 2017 to 2019. Rescuing the Childhood of Afghan Girls was a 2-year project, and it was funded by World Vision United States. As a regional team, Natia and we supported field office colleagues with evaluation methodology and tools, while later Natia was also directly involved in the final measurement. Let us just keep in mind that the project was implemented before COVID as well as before government transition in Afghanistan. So this is past period learning and might not be applicable to current context. As you may know, child marriage is a global issue. It is driven by gender inequality, poverty, and conflict, and has devastating consequences for everyone, but especially girls. According to UNICEF, in Afghanistan, child marriage has been increasing for the past few years, driven by families' severe need for economic support, now reaching its peak with COVID and the former government's collapse in Afghanistan. According to UNICEF estimates, in Afghanistan, 28% of Afghan women aged 15 to 49 years were married before the age of 18. And consequences of child marriage are also known, but according to our latest research in World Vision, women that marry early are more likely to have poor mental health, have no control over household assets, and are more likely to experience gender-based violence. As a child-focused and faith-based organization, in 2017, World Vision designed a project with an innovative approach to reduce incidents of child, early, and forced marriage, also referred as CFM. Since Afghanistan is predominantly a very conservative Islamic country, the two-year project aimed to directly engage faith leaders, mullahs, as the most influential and respected stakeholders locally, to equip them with facilitating the dialogue with their followers in order to explore and transform underlying beliefs and norms that supported CFM. The project's theory of change was shaped around raising awareness of target communities on the negative consequences of CFM through faith leaders who were considered as change agents, as their increased knowledge and commitment would transform into social norm change over the years, which in turn would affect behavior patterns of targeted families. At the same time, the project worked with girls and boys, equipping them with decision-making skills and knowledge about their rights and responsibilities, as well as educated their parents, especially fathers, on harmful effects of early marriage. At the policy level, World Vision Afghanistan established Faith Leaders Forum in each province, comprised of members from various entities, namely the Department of Religious Affairs, Sharia Faculty, Islamic School, Religious Council, and the Private University Union. To support the forum, advocacy action networks were established at the district level, each having 6 members to represent their own community and its negative social norms. Now my colleague Natia will continue with the project measurement overview.
This is Natia, and as Kate said, I will speak about the measurement approach. The main goal was to measure social behavior change regarding CFM through knowledge, attitude, and practice survey. The CUP survey was administered twice, during the baseline before start of the project and at the evaluation when project was finalized after 2 years. The quasi-experimental design was applied with control and intervention communities, covering the target groups such as faith leaders, including community leaders, both male and female, parents, and their children that were between age of 12 to 18. The reason we decided to apply quasi-experimental study was to compare the results and the project impact between control and intervention groups, and to analyze and conclude if any change could be attributed to a project. In terms of sampling strategy for this study, we had almost equal number of community members for baseline and evaluation, as well as control and intervention communities. It was not a panel survey, and randomly selected community members participated at each time, since the project was aiming to have a community-level change. In terms of study tools, we adapted and contextualized them from existing measurements and approaches, and intentionally included measurement of social norms. The tools were developed specifically for each target group, covering knowledge, attitude, and practice. Knowledge-related questions covered the negative consequences of the early marriage, while attitude aspect was relying on measuring social norms. The practice part also included commitment to end early marriage, alongside the actual behavior aspects to it. The findings of the baseline and evaluation analysis suggest that faith leaders are the key agents of change in the community, and changing social norms includes not only changing personal beliefs, but normative expectations as well. The project had a significant increase in knowledge, which also led to increased commitment to end CFM, not yet translated into the behavior. The project had a significant effect on raising awareness on the issue through making it as a frequently discussed topic at the community level. It also contributed to increase awareness on alternatives to early marriage. As a reflection, we can share that changing social norms requires longer-term interventions that are informed with ongoing monitoring data. As within the short-term project, only increase of knowledge and commitment can be achieved. Another learning relates to the importance of having any community member as a change agent and reaching out to them not only through PACE leaders, but directly through targeted activities. The last learning relates to the design of the project. It is our conclusion that social norms change should always be a central part of the project, especially when gender transformative interventions are intended. Thanks a lot for your time, and feel free to share your questions and comments via the email that is indicated in the slide.
Sanjeev sir,
Thank you very much for the first presentation. Very interesting presentation. We'll hold our questions till the end of the other two presentations. I'm also looking to ask a couple of questions. I encourage the attendees to put their questions in the chat box, and we'll be taking it up after the two presentations following this are over. So let's go to the second presentation, Sustaining Behavior Change with Local Government Engagement, Suhara, a success story of Nepal. I guess Bishu will be presenting if we have the recording. Asim, can we play the second presentation, please?
Namaste, this is Bishowraman Neupane, Director, Multi-Sector Governance, Suhara 2 Program Nepal. I am presenting this on behalf of Pooja Pandirana, Chief of Party, Suhara 2 Program Nepal, and Indradhoj Chhetri, Senior Manager, Outreach and Risk Communication, Suhara 2 Program Nepal. My presentation is about sustaining behavior change through local government engagement. Suhara 2, a success story from Nepal. In my presentation, I will share how we are successfully engaging local officials through our frontline workers and Suhara 2 staffs to find and allocate funds that not only sustain Suhara 2 behavior change activity, but also scale up and broaden its scope during the project cycle itself. Similarly, how we were able to contribute or continue our oversight into the municipality adaptation of Suhara 2 approaches and priorities is their one, and translating them into a very local context. This slide is about the Suhara coverage. The USAID-supported Suhara 2 program aims to improve the nutritional status of women and children in at least 2 million households across the 42 districts of Nepal. It covers 389 municipalities and 3353 wards. This is the slide about Nepal's nutrition governance structure. Nepal has 3 tiers of government: federal, province, and local governments. Nepal has been implementing the National Multi-Sector Nutrition Plan, which provides guidance on the nutrition architect. The new constitution shifting to federal system decentralizes decision-making power and control over the budget to the local level. So this is the structure of the local governments, and local governments are primarily responsible to implement the development projects. This is the slide about the 7-step process for allocation of budget for nutrition. Suhara has been working with local government, and it has been participating in community planning meetings and a representation of vulnerable groups and advocates for inclusion of nutrition interventions. During the planning process, Shuara shares community needs, program data, HMIS data, trends. It also engages with the multi-sector nutrition committee members to prioritize high-impact, context-specific nutrition interventions. Shuara closely works with the local government and informs on the need to invest in nutrition as a human right. It sensitizes local leaders on high returns on investment in nutrition, including reduced healthcare costs, more years of schooling, and ultimately a more productive workforce. Motivates leaders to include nutrition in their political manifestos as a part of their development agenda and is supposed to reflect on their plans and identify strategies to translate their commitment into actions. It supports in operationalizing nutrition and food security steering committee at local level. A menu of context-specific nutrition intervention was jointly developed with health and non-health sector coordinators that are included in their annual work plan. It enhances collaboration between sectors to strengthen the technical, managerial, and operational capacity in multi-sectoral nutrition planning and budgeting with local government. Follow-ups on the progress of planned activity through the joint discussion sessions, field visits, and implementation on progress review. This is the slide about our interventions. Shuara 2's over 1,500 frontline workers provided interpersonal counseling to the 1,000 days families and mobilized communities for sustained behavior change. Shuara 2 continuously encouraged community-based frontline workers and major service delivery platforms to advocate for access and control over local funds for nutrition-related activity to improve the nutrition status of the target groups, especially the marginalized people, women, Dalit, and Janjati. Shuara 2 supported them on budget allocation, the efficacy of programming, and the prioritizing expenditures. It also become a trusted partners, increasing the allocation and percentage of municipality expenditure for funding Shuara initiatives. Local government and Shuara have been developing a tracking mechanism using checklists to enable municipality established groups to monitor appropriate utilization of local grants allocated by municipalities and achieved expected outcomes. This is an example of results. Currently, 90% of the municipalities where we work in allocate budget to sustain Shuara's SBCC activities. You can see the increasing trend of allocation and utilizations. So far, 41 million USD has been leveraged by the local government and 22 million is utilized for nutrition cause. Local governments replicated our behavior change activity at the household and community levels and added some key life events where milestones during the 1,000 days are celebrated to promote and reminded key behaviors. Local governments also allocated budget for making malnutrition-free wards, and they have planned a massive campaign for this event. Motivational allowances for female community health volunteers to conduct monthly mothers group meetings. Mobilization of peer facilitator to conduct nutrition counseling in underserved household. Local governments recruited Shuara to train nutrition frontline workers with their own budget for the nutrition interventions. During the implementation, we have learned various lessons. Shuara 2 program quickly adapted to the new federal system with devolution of planning and budgeting to local levels, which allowed it for early and continuous engagement of local leaders in planning, budgeting, and tracking nutrition intervention. This included supporting local leaders to adapt Suara to SBCC intervention for improved nutrition, focusing on translating them into their local context and enhancing the local level ownership and sustainability. The local governments have recruited frontline workers from Suara to, resulting in improved institutional capacity for nutrition. This is the slide about the implication for the field. Structural change in government, while sometimes disruptive for program implementation, can also be turned into an opportunity for identifying new strategies for local engagement. Investing in staffing to support local leaders is essential to yielding results in terms of integration of nutrition intervention into the local plans with budget. It is possible to introduce and maintain nutrition on local government's agenda. It is possible to compete again more noticeable projects such as road construction by supporting good governance practice and structures and reinforcing local leaders to invest in nutrition. In conclusion, we can say that we foresee a dramatic increase in local government ownership of Suara programming as these leaders share their success stories with their colleagues across Nepal in the future. With this, I am going to conclude my presentation. Thank you for giving this wonderful opportunity to present about the Suara success in this valuable forum. If you have any queries, concerns, and questions regarding this presentation, we are happy to answer, and I would request Pooja ma'am, Indra, Kshetriji for responding the concerns raised from the audience. Thank you. Namaste.
Thank you very much for presentation number 2. Or if I understand correctly, a little bit of the word Ahara means suposhan, as we call it in our Indian program here, for example.
Yes, sir. Yes, sir. Good nutrition.
Good nutrition.
Yeah.
As we call our Indian nutrition program is called suposhan or poshan. It's very interesting to see parallels. I'm sure there'll be some interesting questions about how Indian program ICDS and Suposhan kind of compares this with this, and what kind of learnings are there. I'm sure a lot of interesting comparisons can be easily drawn. Thank you very much. I look forward to those questions once we have finished the third presentation, which is again, I'm saying I was intrigued by the titling of it: fail early, fail fast, fail often, but do not fail big. Managing behavioral science-backed innovative products and services in 3 low-income countries. Presented authors by Reshma, Cecilia, Sohrab, Zakari, Keset, and Muhammad. I'm very exciting to look at. This is quite a large study, I guess, 3 countries across. And we don't usually talk about failing and learning. I always talk about success stories sometimes, but I think failures are a great learning. Look forward to this presentation. Asim, can we have the presentation, please? Thank you.
Thank you for joining the Resolve Project's presentation, Fail Early, Fail Fast, Fail Often, but Don't Fail Big. I'm Sohrab Hussain of Pathfinde International and former program manager for the Resolve Project in Bangladesh. The Resolve Project, implemented by Pathfinde International in partnership with International Center for Research on Women, ICRW, Ideas 42, and Kemper Collective, seeks to develop innovative behavioral science-backed services and products to address the drivers of contraceptive non-use in Burkina Faso, Bangladesh, and in Ethiopia. The project is funded by the Bill and Melinda Gates Foundation. During this presentation, I will provide an overview of the intervention in each of the 3 countries we implemented in, and the decision gates we developed to determine which ideas could and should be taken to prototyping and scale. I will then share examples of ideas and prototypes that failed in each country and why, and what we learned from our failures. Resolve uses a combination of expertise in consumer insights, behavioral design, and public health to determine the barriers to contraceptive uptake for women who wish to avoid pregnancy and to develop targeted context-specific intervention to address them. Through segmentation analysis and behavioral diagnosis, Resolve developed solution sets targeted at select populations in each country. In Burkina Faso, we developed a solution set made up of a board game, health passport, and health facility posters featuring services for unmarried girls in Ouagadougou and Bobo Dioulasso. This solution set helped us to address misconceptions about modern contraceptives and correct girls' pregnancy risk perception. In Bangladesh, we designed a planning prompt, reminder stickers, and integrated voice response system to help women manage side effects and seek appropriate counseling, and a case-based training module for counseling female garment factory workers in Dhaka region to ensure that garment workers correctly and consistently use oral contraceptives. In Ethiopia, we developed a series of job aids for use by providers and health workers during antenatal, postnatal, home visit, and immunization services to reach postpartum women in Tigray. These job aids provide correct information about lactational amenorrhea method and provide postpartum women the tools to assess our own pregnancy risk. Our project team was based in 8 different cities around the world. We needed a commonly understood and transparent decision-making system at each phase. We deliberately designed 3 key decision gates with criteria which would help us to determine which barriers we would prioritize and address through our solutions, which ideas we would move to prototyping, how we would advance, pivot, or discard prototypes based on user feedback. At the first decision gate, we assessed and prioritized behavioral barriers to contraceptive use based on 3 criteria: relevance to the problem, evidence, feasibility to address within the project period. At the second decision gate, multiple stakeholders scored the ideas we developed to address the behavioral barriers according to potential impact, scalability, feasibility, and degree of innovation. The top 3 ideas we prioritized and advanced to prototyping. At the third decision gate, we user tested the prototypes we had developed based on the result of the ideation phase. Based on user feedback, we were able to assess each prototype for likability. For an example, did the end user engage with the prototype? Ease of use. For an example, did they easily understand the prototype? Or did it need a lot of explanation? And acceptability. For an example, were they likely to use it? As you can imagine, not every idea became a prototype, and not every prototype became part of the solution set in each country. The 3 decision gates provided the needed boundaries or constraints within which we could design and innovate ideas and solutions that fell outside the boundaries failed. With each failure, we learned and made decisions on whether we should continue to strengthen an idea or prototype, significantly modify it, or discard it. In Burkina Faso, we designed an appointment card and memory aid for wellness checkups for health workers to use with unmarried schoolgirls at health facilities. While reviewing and scoring this solution, stakeholders shared that health workers did not have the time or resources to offer additional services or use new tools. This meant these prototypes were neither feasible nor scalable, leading us to discard them. In their place, we designed 2 new solutions, the health passport and poster, that did not require additional level of effort from the health workers and were instead focused on encouraging the girls to attend the facilities for already existing services. In Ethiopia, we user tested a family pledge and an exemplary family certificate, both designed to encourage dialogue between couples and to frame the joint responsibility of couples for the well-being of their families. However, health extension workers, who are predominantly women, did not feel comfortable administering the family pledge to husbands. Husbands confirmed this perception. When we spoke to men, they told us that the health extension worker take care of their wife and child, and they don't feel the need to talk to her. Health workers also expressed concern that including husbands in this conversation could raise problem if wives had chosen to use a contraceptive method discreetly. For these reasons, the prototypes were not acceptable for their proposed context, and they are discarded. Unfortunately, due to COVID-19 pandemic, Resolve made the difficult decision to close early in Bangladesh before we were able to implement the solutions we had designed and user tested. However, we were able to take what we had learned from adapting at the decision gate points to give one of our solutions another life, the interactive training module for case-based counseling for providers. This module was originally designed as a mobile app. The Directorate General Family Planning of Ministry of Health wanted to take up this module, but testing and scaling up a tech-based solution would have required a lot of resources. We were able to work with another Pathfinder-led USAID-funded Sukhi Jiban project and the Directorate General Family Planning to transfer the content of the app to flashcard, which can be easily be produced and supplied to clinics in garment factories. We will be testing these flashcards in 50 garment factories next year. While not being able to continue with the app we designed could be seen as a failure, we see this is an example of how we failed forward, taking what we had designed and learned and adapting it to the particular context. Resolve's strength as an intervention is in its adaptability. We learned that there are many reasons that a prototype can fail. Maybe it is not relevant, feasible, sustainable, acceptable, or likable as envisioned or designed. The decision gates and criteria we developed allowed us to create a common set of guidelines for when to discard an idea and when to pivot or persist. But these failures mean that we could pivot our ideas and designs and learn and adapt rapidly, all while still focusing on the behavioral barriers we wanted to address, and more importantly, centering the voice of our end users, women, girls, and frontline workers in Bangladesh, Burkina Faso, and Ethiopia. This also meant that we could address our failures early on before a solution was taken to scale. Failing early and often during the initial design phase saves valuable resources and prevents a bigger failure later on in the intervention. We believe that being prepared and willing to fail often and early on in the design process led to stronger, more responsive interventions and services. We expected that we would fail and fail often and designed the process with this in mind. Each of our failures are constructive and allowed us to learn how to fail forward and continually adapt to develop the strongest solution sets to address behavioral barriers for non-use of contraceptives. Thank you.
Thank you very much to all the wonderful presentations. These are very diverse, interesting field, and that is why the session entitled was that we are talking in terms of joining hands with innovation, from early marriage to nutrition to contraception. These are three very interesting fields. I've been involved in almost all the three fields in my capacity as a social and behavior change communications and development communications person for a long time. I have so many questions in my mind. I'm sure you too have some very interesting questions which you have arising, probably looking for some little bit more detail, or certain questions which are relevant to your country specific situation, or probably something which you find in agreement or you want to try and experiment in your setting, in your location as well. But let's begin with the first question which Uttara had raised. And then we will go to a second question which Chitra has raised, but let me read out what Uttara had raised the question. Uttara has raised the question how to the early marriage presentation, which is either Kate or Natia can respond. The question is how have the recent political changes affected this program? There has been certain recent scale of change as well as political change in Afghanistan. And you did mention that it was before COVID, and that is another big change that has happened after that. How do you respond to Uttara's question of how have these recent political changes affected this program?
Thank you so much. Yes, I will try to answer, and maybe Natia can add if I miss anything. That's a very good question. Well, the project itself that we have been presenting here, it has ended in 2019. So in a way, we were kind of lucky that we managed to complete it, and we had some learnings, and it was considered as a success. But on the other hand, of course, there are many other similar projects currently implemented, and they were implemented in Afghanistan before the government transition. Unfortunately, in the process of the chaos, we had to go, as an office, we had to go in a hibernation for several months just to understand what's the dynamic at the local level. Are we able to work? Is it safe for our staff as well as for our beneficiaries to receive further support from us? And at the moment, the situation is that only life-saving activities such as health interventions are allowed. So any other projects like women's education or women employment or women empowerment initiatives, all of them are on hold. And only few of our employees, only in the life-saving reproductive health projects, female staff is allowed to work in the field. So this is current reality, and we do hope that the promises that has been made by the new government, by the new de facto government, they will be fulfilled, and we will be back to our normal operations soon. Thank you.
Thank you, Kate. Uttara, do you have a follow-on question or any other aspect which you would like to further explore on that matter?
No, Sanjeev, thank you. Maybe Natia has something to add. I just wanted to say that it's a really challenging situation. I know we're grateful to have seen the presentation, and we want to acknowledge that it's terrific work, and we really hope that there is a way that that impact will continue. Thank you.
Thank you. Natia, I had small intervention before I go to the second question about the measurement part. You did do KP before and after baseline and line. Are there any measurements in terms of what you actually achieved in terms of social norm or perception or acceptance? And it's a very interesting choice of faith leaders as change agents. And I'm sure you're aware that in India, we also face an early marriage challenge. And there has been very interesting innovative experiments and pilots done over the period of time, especially in Rajasthan, Bihar, Haryana, and provinces like that. So two parts, the small question before I ask Chitra's question on presentation number 3. One, was there any significant change in any variable which you found in KAP baseline and endline? And number 2, I'm sure you're aware of how things have been done and undertaken, some very interesting innovative projects, designs and implementations in India. Do you see some possibilities of those being applicable there, or do you see some applications, what you did here, probably applicable here?
Thanks a lot for the question. And thanks to the panelists as well, presenters for other presentations, really interesting indeed. So I don't have any other input on the question 1 in terms of government takeover and its effect on the program. I think Kate covered it quite well. In terms of measurement and impact, so basically the project, it has been implemented only for 2 years, and it had quite success in terms of increasing knowledge of negative consequences of early marriage, and increasing the commitment from the community leaders to end the early marriage. And the commitment was speaking about it, encouraging each other not to engage in this behavior. But in terms of social norms, there was a small attitude change in the intervention communities in comparison to the control communities, but it did not transfer to the actual behavior change in terms of prevalence of early marriage at the community level. There were several cases, 19 cases, when World Vision facilitated ending the child marriage, but it was not significantly at the community level. So to just summarize, the project impact was at the knowledge increase level and at the commitment level, and very, very brief, very short impact on the prevalence aspect, but not at the community level. In terms of replication, I believe what we can replicate is, depending on the project, we can replicate the measurements. We can share the measurement tools that we had, some learnings that we had, and if it's applicable in that context, we can use those measurement tools, adapt them in the specific context, and see how the measurement will go. So the replication of the project, I believe that depends on the context a lot, but that also could be discussed bilaterally in future. Thanks so much.
Thank you, Natia. That's interesting. Just a small little caveat. I'm sure you are in your literature review, you would have undertaken some of the interesting work India faces similarly in early marriage situations. There were some very interesting success stories and experiments done here. Are there any lessons learned which might be useful to take forward from here to there or from there to here? Maybe Kate can answer.
Sure. Well, I think Natia gave a very good introduction in terms of the challenges and therefore the lessons, the bitter lessons that we learned as a result of this project, primarily related to the duration of the intervention, which we know that in order for our knowledge and attitude to translate into behaviors, it does take time, and 2 years is definitely not enough to achieve the behavior change. Another thing that I recall from the presentation also is in terms of having this holistic approach. And yes, of course, the faith leaders are the gatekeepers, right? So they do hold the power and they are the ones that people listen to. But there are also other informal authorities locally at the village level, and approaching them and engaging them and really investing as much as possible into this conversations and pre-work before our main interventions will start. I think this is the key, because we just want to jump into the intervention and raise awareness and engage parents and children, but if we don't have sufficient support from all these power holders, then it's really hard to really achieve any major impact. Natia, would you want to add anything in terms of lessons?
I think it's well covered, Kate. Thank you so much. I don't have any other points. Yeah.
All right. Thank you very much. It's a very interesting issue, and I look forward to things getting normalized and things being taken forward. There's a very interesting question by Chitra to presentation on the prototypes. Chitra's question says, between being the most impactful in addressing the problem versus being the most receptive by the target community, which should be a priority in developing a prototype? Saurabh, would you like to answer? This is a very interesting question, and I read it again for you. Between being the most impactful in addressing the problem versus being most receptive by the target community, which should be a priority in developing a prototype? Saurabh, are you there?
Yeah. Thanks for the question, and thanks to Chitra Devi for a really thought-provoking question. And And I'd like to let you know that our project director, Reshma Trasi, is here, and I'd
Reshma
like
is here,
to
yeah.
kindly request if Reshma can answer. Thank you.
Sure. Reshma, would you like to answer that question? Do you want me to repeat that question for you?
No, I see it, Sanjeev. Thank you so much. And again, just thanks to the organizers for a really interesting and very diverse panel, taking on some very diverse issues as well. Chitra, to your question, I think the way that we approached it was to look at these issues at different points in time, right? So when we got to the point when we were starting to think of ideas and we were trying to score them, we took on some of the big questions, which was, is the idea relevant? So is it addressing the behavioral barriers that we are seeking to address in that particular context with that particular population? We looked at potential for impact. So, it's this question you're asking, was something going to be impactful in addressing the problem? And when we looked at the evidence around, the idea or the science behind the idea, we looked at that at the idea generation stage. So before the prototype stage is when we took this on. The evidence that we looked at behind the idea was not just evidence in global health, but if that idea had come from somewhere else, for example, planning prompts, there is a fair amount of behavioral science that is, backs the importance of planning prompts in carrying through from intention to action in several other areas of behavior change, not just contraceptive non-use. So we were looking at evidence there as well. And then the third sort of big criteria that we had at the idea stage was feasibility. The idea that we're thinking about putting in, is that sustainable, potentially sustainable in the context? What is it going to cost? If we have to pass this on to the government and we're working with government, can government take this on? Or is this going to die, at the end of a pilot? Like, these were important big questions for us to get right. And then once we had gone past the stage into prototype and the prototype was taken to user testing, then what the target community thought was front and center. Then all of these other issues sort of fade a little bit into the background because we had already graduated those ideas into prototyping that did meet the criteria of relevance, evidence, and feasibility. So when we got into the community to test and user test and blind user test, the voice of women and girls took primacy. That was the only thing that we were considering when we were iterating on these prototypes over and over again. So I don't know if that sort of answers your question. I think both are equally important, but I think the sequencing of that criteria as to when do you consider impact and when do you consider, the reception and the likability and the acceptability of an idea or a prototype by the community, at least that's the way we played it out within the Resolve project. Thank you.
Thank you, Reshma. Chitra, do you have any rejoinder or any other aspect you would like to dwell upon?
No, I think that was a really excellent answer. Thank you so much for clarity.
Thank you. I have a question, Reshma. Since I also get a lot into research-based prototypes and products being developed innovatively to reaching out to community, especially also for family planning. My question is simple. Obviously, the prototype development must have been based on some formative research or evidence which probably suggested that this is the kind of messaging or intervention you need to dwell upon, right? But the creative rendition of that is the program person or the team which actually comes around that. So translation of what you find out into what product or form it will take is a creative rendition team's decision, more or less. And then it gets into a testing stage. So I'm just trying to wonder, when you develop, let's say, mobile app or, for example, interacting with men, there must have been a compelling need to translate that into particular intervention in the field. So I'm just trying to understand this transition process from evidence to product to then testing. Does it seamlessly follow, or is it the trial actually tells you that it doesn't work? Maybe the trial requires a little bit of absorption before the field accepts it, because the first you introduce anything new, it is sometimes not easily accepted or probably skilled to do so. For example, handling men in discussion or dialogue, which probably didn't work out well in the field, in the piloting.
Yeah, I mean, that's a really good question, Sanjeev. I think so, just a quick comment on the formative assessment. So it was, we spent almost about a year and a half in the sort of that formative assessment phase, because the project, the way that it was designed, we were combining segmentation analysis sequentially with behavioral diagnosis. So the behavioral diagnosis was being informed by behavioral economics, social psychology, anthropology. And so, we were almost sort of combining and sequencing a very quant heavy assessment of what the behavioral barriers and the drivers were. And then from there, we were going deep, digging even deeper from what was surfacing from the quant barriers into the qual sort of data, which was the behavioral diagnosis piece of it. So, there was a fair amount of iteration, I would say, at that point in time, and a lot of time on trying to really figure out what were the barriers, A. Second, which of the barriers could we feasibly take on? Because we were also being very pragmatic at that point, right? Like we had a 4-year project, and we knew that we had to quickly move from sort of the formative sort of research into the translation, which was the idea generation, the prototyping, the testing, the evaluation, because we also did randomized control trials in this 4-year period. And that was the mandate of the project as well. So, the work was informed by the formative research, but I think one of the key places where, when I now reflect, so we've completed our work in Burkina Faso. As Saurabh said, we had to prematurely sort of, and unfortunately, phase out the program in Bangladesh. We're still live in Ethiopia, but in fact, doing evaluation as we speak in very challenging situations in Tigray, for those of you that are following the situation there. So I think one of the places that we did struggle was on translating the social norms piece. And the male engagement piece that you're getting at, that was among a set of barriers for each of the populations that was really pertaining to addressing social norms. And so, when we had a list of about 10 or 12 barriers that we had barrier-based sort of insights that we created in each of the countries, we had to sort of pick and choose. And that's where the feasibility piece also came in. We looked at which of these barriers can we feasibly address within a 3 or 4 year period. And so even when we took on the male engagement piece, we took it on because the government of Ethiopia asked us to specifically. But we knew going in that this was going to be a piece that was very challenging. That was going to be very challenging for us within a 2 year period to show any kind of change. So, it was a lot of iteration, I would say. When we finally carved out the solution set, I think we managed to hit, the key behavioral barriers in each of the countries, but there were definitely other barriers that we were not able to do. And I think, that's a little bit of what life is, right? You sort of win some, you lose some. But we were really pleased to see that the barriers that we were able to address, at least in both Burkina Faso and Ethiopia, we were seeing very, very early promising changes. And I'm happy to drop some of the URLs for our technical briefs and our evaluation reports in case others are interested. I hope that sort of gets at a little bit of what you're raising.
I fully understand, and thank you very much for that. I worked in the male engagement field for quite some time now, so I always find that quite fascinating. How do we overcome and facilitate that particular entry point to a facilitating point so that men are able to see things differently? But thank you very much. Is there any other question from participants? Otherwise, I'm itching to have one question to the Suhara team. Anybody? I encourage my participants, my attendees to raise a question. And I see, well, just to inform you, we are going to into session 4 and session 5 after this. I encourage you to join that. But we have a minute for a question to the Suhara team. Bishu, are you there?
Yes, sir. Yes, sir.
Okay, Bishop, my question is very simple, and I think it's a very interesting thing about engaging local governments and local government structures to involve in the Suhara nutrition projects, for that matter. In India, for example, you know that we have Anganwadi workers and we have now Poshan Sakhis and things like that.
Yes.
I sometimes feels that handing over HR structure or HR support in terms of field level functionaries, which you train and which you kind of demonstrate that they kind of work. It's probably a simpler solution rather than behavior change solution in terms of the local government understanding the perspective and the dimensions of why and how this is important, and then they assimilate this other than just having a person who seems to have been trained and developed and shown that it works. What do you think about that?
Yes, sir. Nepal Suhara has trained many frontline workers, and we also make them internalize that invest in nutrition is key for their future generation, and they are quite internalized, and they are agreed to include this agenda in their municipal plan, not only in the municipal plan but also in their discussion for planning process, especially the settlement area and world level discussion. They just identify the key drivers of malnutrition and what are the barriers for human development. So they just internalize, and they also assure that this is the key intervention. Behavior change intervention is the key for whole generation. So they just asked Suhara to, okay, you have already trained, oriented, and capacitated the frontline workers, and we in Nepal's government, Local Government Operation Act, they are very free to appoint the local cadres or local facilitator in their context. They are leveraged to appoint that. So they asked Suhara, okay, after this Suhara program, the person whom you have trained can be replicated or can be recruited with our fund. So I think this is quite, the internalized process, and that they are convinced, and more importantly, they have integrated this nutrition agenda in their election commitment paper as well. So this is the significant agenda, and we'll discuss within our political platforms, not only the political platform, but that will be translated into the municipal council and the annual work plan, and sustain this for coming years. Thank you, sir.
Right. Thank you, Vishu. And I think it's a great idea. I was only the last question and the small supplementary before I close, because we are running out of time. Is there a measurement to show what is the level of impact in terms of reduction in malnutrition or improvement in terms of complementary and supplementary feeding increased during this period by engagement of local governments and these field level functionaries? Is there a measurement in terms of?
Yes, sir. Yes. To measure this, we have planned for research, and the report will come soon, but it is in the process now. And we'll be happy to share these findings.
That'll be a more compelling reason for them to kind of integrate and even bear the cost of long-term costs of the projects. Thank you.
Yes,
Thank you, Vishu. And with this, we come to the end of this particular session. And I really thank all my presenters and my attendees who came over to this particular session. I wish we had more time. I could have gone in for a longer discussion, but I encourage you to join session number 4 and session number 5, which begin at 11:50. And if you have still any more questions, and as I think the recordings would be shared, the presentation would be shared. And if you have any more questions or ideas or further detailing in contact, you probably should do so, and we'll encourage you to do so. Once again, I thank you. I thank my team and all the presenters who took their time to share their ideas and their questions with us, and look forward to take these learnings and these insights from these projects forward into some of the work which I do and my team does in Delhi and in India. Once again, thank you everyone for joining in today, and look forward to you in the other sessions of the conversation. Thank you very much and have a good day. Look forward to you in the next session.